Hey, so my name is Chris. Today I'm going to be talking to you about treatment for recurrent low-grade serous ovarian cancer. So the study that we're going to be looking at is GOG 281. But to give us some background, low-grade serous ovarian cancer is one of the 5 main subtypes of epithelial ovarian cancer. It's similar to high-grade serous, but differs pathologically in the sense that there's less nuclear atypia and fewer mitotic figures. Molecularly, it also differs because high grade usually has mutations in TP53, where low grade doesn't really have that frequency of mutation for 53, but usually has mutations in the MAP kinase pathway. And I've had a figure right here just to show kind of the drugs and interactions along that pathway. So herein lies GOG 281, which is by Gershenson et al. Coming out in 2022, which was looking at oral trametinib versus standard of care for patients with recurrent low-grade serous ovarian cancer, confirmed by RECIST criteria. And the drug of interest in this paper was trametinib. This was an oral medication, and this was a selective reversible allosteric inhibitor of MEK1 and MEK2, which is part of that MAP kinase pathway. So in talking about 281, it's hard to not talk about Milo at the same time because they were both trying to answer the same question about recurrent low-grade serous. But the populations were different in both groups, and I'm showing it right here, and that's really how pre-treated these populations were. So for 281, as we can see from this graph, 48% had 3 or more systemic lines within 281, and that's only 30% within the Milo group. When you're looking at only 1 prior line of chemotherapy, 22% was in 281, where it was 41% in Milo. And additionally, within 281, 58% had 1 prior line of hormone therapy as well. So using that information, we can understand that the 281 group was more pre-treated compared to the Milo group. So now jumping into the treatment arms. So treatment arm 1 would be oral trametinib, which was initially dosed at 2 milligrams daily. And that was then compared to standard of care arm, which used the 3 regimens that were also in Milo. So that was going to be pegylated liposomal doxorubicin, weekly Taxol or topotecan, but it also included letrozole or tamoxifen. So the primary endpoint for this study was met and significant, and that was progression-free survival. And that was 13 months versus 7.2 months from the oral trametinib to standard of care, which was a hazard ratio of 0.48, meaning that there was a 52% reduction in progression or death if patients were on oral trametinib compared to one of those 5 standard of care regimens. The median OS was 37.6 versus 29.2 months. And that's also important to note, being that 88% of the standard of care group ended up crossing over into oral trametinib after they ended up having recurrence diagnosed. And the objective response rate, which is the number of complete or partial responses. So the objective response rate within trametinib was going to be 26.2 versus 6% within standard of care. One of the other things to talk about would be the side effect profiles when giving patients oral trametinib as well. So for grade 3 or grade 4 toxicities, there was 13% having skin rash, 13% anemia, 12% hypertension, and that was in the trametinib group. And then for standard of care, there was 17% for abdominal pain, 11% for nausea, and 10% for anemia. So the main finding of GOG 281 is that oral trametinib, which is a MEK1, MEK2 inhibitor, is effective and superior to standard of care regimens in patients with recurrent low-grade serous ovarian cancer. Another thing to note about the paper is when they looked at the progression-free survival, they actually looked at not only just standard of care versus trametinib, they also looked at all the specific 5s compared to trametinib. And when you're looking at the median progression-free survival from that pre-planned analysis, for the letrozole group, there were 88 patients, and that progression-free survival ended up being 10.6 months. And then when you look at the tamoxifen group, that progression-free survival, as this graph is showing right here, was only 3.7 months. And that's GOG 281, the more you know.